Today's topic is sinusitis. Sinusitis is a common inflammation of the lining of the sinuses, the cavities that produce the slimy secretion mucus, necessary for the nasal passages to work effectively, keeping the nasal passages moist as well as trapping dirt particles and germs. A sinus is a hollow space in the body. Many types of sinus are present in the body, but sinusitis affects the paranasal sinuses, the air cavities behind the cranial bones, especially those near the nose and connecting to it. Healthy sinuses contain air, but when they become blocked and filled up with fluid, germs can grow, and this can cause an infection. It is also known as a sinus infection or rhinosinusitis. Sinusitis is classified into several categories. Recurrent acute rhinosinusitis is marked by 4 or more full episodes of acute sinusitis that occur within a year. Subacute rhinosinusitis usually lasts 4 to 12 weeks. Chronic rhinosinusitis lasts 12 weeks or longer. Chronic sinusitis can lead to complications such as meningitis, infection of the bones of the forehead and other facial bones, or infection of the eye socket, which may result in vision problems. Chronic sinusitis affects approximately 12.5% of people. Sinusitis is more prevalent in women than in men. Causes. Common causes of sinusitis include respiratory tract infection, most commonly colds. These infections can be viral, bacterial, or fungal. Allergies. Nasal polyps. A weakened immune system due to a health condition or some kind of treatment. Structural problems in the nose, such as a deviated septum. Air pollutions. Chemical irritation, such as from cigarette smoke or chlorine fumes. Risk factor for getting sinusitis include asthma, regular exposure to pollutants such as cigarette smoke, aspirin sensitivity, medical conditions such as cystic fibrosis, gastroesophageal reflux, HIV. Symptoms. For acute sinusitis, symptoms may include a cough or congestion, stuffed up or blocked nose, facial pain or pressure, thick nasal discharge, usually green in color, and may contain pus and/or blood, reduced sense of smell, fever, a toothache, localized headache. In more advanced cases, the following symptoms may also be present: pain, tenderness and swelling around the eyes, cheek, nose, or forehead, halitosis, bad breath, fatigue, ear pain, nausea, a sore throat. You should see a doctor if any of the following are present: high fever, a severe headache, stiff neck, double vision or other vision changes, confusion, swelling or redness around your eyes. All these could indicate a serious infection. Diagnosis and treatment. To make a diagnosis, the doctor will carry out a physical examination. During the physical exam, the doctor will feel for tenderness in your nose and face and also look inside your nose. The doctor may examine the inside of your nose with a light source or a small handheld device with a light attached called an otoscope. This can also be used to examine the ears. Other diagnostic tests that can be used are nasal endoscopy. Imaging studies such as a CT scan or MRI can show details of your sinuses and nasal area. An allergy test if allergies are suspected to trigger your condition. In rare cases, nasal and sinus cultures. Treatment. The goal of treatment is to reduce the inflammation, eliminate the underlying cause, keep the nasal passages draining, and reduce the number of sinus flare-ups. Decongestant and saline nasal washes may be recommended if you have a simple sinus infection. Immunotherapy may be recommended if you have allergies. Antifungal medicine may be prescribed if your sinusitis is due to a fungus. Antibiotics such as amoxicillin may be acceptable for bacterial infection of the sinuses. In cases resistant to treatment or medications, endoscope sinus surgery might be an option. The doctors may use a series of instruments to remove tissue or shave away a polyp that is causing nasal blockage. Some certain self-help steps that can help reduce sinuses are rest, drinking fluids, applying a warm compress to the face, rinsing out your nasal passages, smoking cessation and avoiding people that smoke, sleeping with your head elevated.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.